Hey, are you a GP who struggles when they code third molars and is just like, man, I don't know what to do? Well, I want to let you know today that you're probably abusing this code to death and you don't want to do that any longer because maldiagnosis causes a lot of problems for you and your patients. Let's jump into it. All right, Dr. Jared Williams. I'm your third molar expert. I've completed over 10 surgical procedures and I've been able to train doctors around the globe on how to do third molar surgery. And if you want to take your skills at next level, this is a channel just for you. Even if you have little to no experience, we train GPs just like you to remove third molars in less than 4 weeks and be proficient at it. So I don't care if you have little to no experience, we got you covered. All right. So in today's video, we're going to talk about the most abused dental code for third molars, and that is D7230, partial bonies. All right. So if you're guilty like myself, it's okay. That's why we're making treatment planning and coding simple for you. So if you're a GP who's like, I don't know what to do, I don't know what to do, let's break some things down here. That's why we got our chart here, and we're going to break it down to where it's easy, impactful, and sustainable so that you could take your skills at next level.
Are you a GP tired of referring patients out of your practice and losing out on production? Did you know third molar surgery is a $3 billion industry? If you are ready, join the 5-day third molar surgery challenge, which will give you the confidence, knowledge, and skills to remove third molars safely. During this challenge, you'll enhance your surgical speed and gain exclusive access to insider secrets that specialists for years have tried to keep hidden. By learning these techniques, you'll be able to serve more patients, add more skills, and be the go-to doctor in your area. Don't miss this incredible opportunity to boost your skills, increase patient volume, and revolutionize your practice. Enroll now and let's embark on this exhilarating journey together.
So the code that we're going to talk about today is going to be D7230. And for all those international docs out there who don't deal with the American Dental Association codes that we have right here, it's okay. It's just a partial bony. So a partial bony is basically where part of the crown is covered in bone or by bone. And so when we look at this, one thing I like to do is say, is less than 50% of the bone covered, is less than 50% of the tooth covered by bone? If it is, then we have a partial bony. All right. Has to be less than 50%. All right. More than 50%? No. Less than 50%. Let me give you an example. So here you have it. This is going to be our x-ray that we're going to go ahead and read. So what I like to do is get the inferior alveolar nerve out the way. So we're good there. After you do that, what I want for you to do is work your way up from the nerve to the root to the crown. And that's how you're going to be coding for success. When you code for success, your patients are going to get the right treatment. They're going to have successful surgeries. They're going to be faster, and you're going to be reimbursed correctly for the treatment that you've worked so hard for. The last thing you want to do is, if you send your patients information to the insurance company and it's wrong, they're going to ding you. And if they ding you enough, you're going to be reimbursed or downgraded in their provider system. And we don't want that to happen. All right. So when you look at this code right here, D7230, which is partial bony, I want you to be aware of that. Once you look at the nerve, then I want you to look at the roots. Because a lot of times there's a lot of docs who just say, oh, it's less than 50%. Oh, it's partial bony. No. Make sure there's no communication with the nerve. If there's no communication with the nerve, then we're good. The roots, that is. So how do we go ahead and plan for cases such as this one? Well, what we do is this. we're going to look at the ramus of the jaw and follow it. Now, when we look at the ramus of the jaw, what we want to do is just basically follow the bone. And one thing I will say is this, is that when you look at the bone doesn't do one of these and then come around towards the tooth. What it does is follows a nice, even path, just like that. So I know a lot of docs are like, well, what about intraorally? Well, if the tooth is visible intraorally, you have to have access to it in addition to reading the pano or the CT. So, gotcha. So with that being stated, this is what I want for you to do is this. I want you to follow the bone and just follow the smooth transition. When you follow that smooth transition, you'll see that partial bone coverage is present on this crown. And even if the distal component is covered up on the occlusal and the distal, I always just throw it as a partial boning. So the reason why you want to do this is because, number one, it gives you an idea of how long you're going to be actually working on this case. It's also going to even allow you to know, hey, do I even need to cut with my surgical burr? Now, you're pretty sure it's like, wait a second, don't you have to cut all your teeth out for third molars, even they're partial or surgical or soft tissue? Ladies and gentlemen, no. All right, that is false. What you want to be able to do is this. When you learn the techniques of third molar surgery, you're going to be able to see that there's certain things, tips and tricks that you'll be able to learn where you don't have to cause too much trauma to your patient to take these teeth out. What a lot of doctors do is that they're so quick to get a handpiece and go and just create a huge bony window to where the patients are going to need a lot of pain medication, a lot of time off work. They're going to need a lot of time calling you at crazy hours because you gave them a lot of pain, and they're going to wear out the medication that you've provided for them. But if you learn how to take out third molars correctly and code them, you're going to know that you could move faster. You're going to be able to also learn how to take these teeth out with treating them in the atraumatic fashion as possible. So when you see a tooth like this and you see that there's partially covered by bone, you know there's a couple things. Number one, I don't have to deal with the nerve. Number two, I'm probably not going to have to cut the tooth out. Number three, I'm not going to have to remove as much bone as I would with a complete boning. And so these are certain things that will be coming to your mind as you start treating your patients. But I want to let you know, you no longer have to abuse this code anymore, because what you're going to do is this. You're going to look at the nerve, look at the root, and then look at the crown and see, hey, is there less than 50% bone coverage on this crown? If it is, then guess what, ladies and gentlemen? You have a partial bony third molar impacted tooth. And there you have it. We like to keep it simple so that GPs such as yourself can really take their skills at next level. And that's all we have for today. Make it a great one. And remember, you deserve to smile after surgery.